if you do not want to be a part of the recording, please keep your camera off and instead write your questions in the chat, and we will read them up and answer them that way instead. But first of all, very, very welcome to everybody who has joined and still is continuing to join this webinar for the intended lead partners or potential lead partners that are interested in applying to the Digit-Pre project. My name is Malin Larsson. I work at Innovationsskane, a Swedish company working with innovation and growth. And I am the project coordinator for this project. And with me today, I have a whole lot of my project colleagues from all across Europe, and you will hear from some of them, and some of them will be here to help us answer questions and act as regional representatives. So yeah, you will hear from a few of us, and yeah, we're of course all here for you in the case that you need us later on. But yes, like I said, very welcome to this webinar. Today we intend to focus a lot on the role for the lead partner. I don't know if any of you joined our previous webinar, which was more focused on the project itself and also the entire sub-project. But as the role of lead partner is a bit more, it's a bit special, which is the reason why we also wanted to give you the opportunity to understand a bit more about it. So this is the reason why we're hosting this today. The session will look like this. We will start by deep diving into, or not even deep diving, we will touch upon the application and partnership process. Then we'll do a short Q&A. And then we move on to the selection process and preparation phase, and then do a short Q&A, move on to starting up and delivering the project Q&A, and then we'll wrap up and do the next steps. So we will take you through the process chronologically. First, give you a short intro with a few slides, and then spend a lot of time on questions and answers. We want this to be an interactive session, so feel free to raise your hands and write in the chat, comment, etc. This is really an opportunity for you to ask all and anything, so to say. But before we get started, just a few house rules. Like I already explained, we will have time slots dedicated for questions. So either use the chat to post your question, or use the hand raising function. It's in the top banner of Teams, and there is a hand looking like this that you can press, and that will give us a signal that you want to ask a question. But try to save them for the time slots that we have for Q&A. Also, I'm sure you all are well aware of digital meeting ethics nowadays, but keep your mic muted if you're not speaking. And also, we're very happy to see you, so keep your camera on if you're comfortable with that. I also mentioned that this session is recorded. And also, remember, there are no dumb questions. There really aren't. So feel free to express all queries, questions, and concerns that you have, and we will do our very best to try to guide you through it. Okay, that was it for the introduction of the webinar. A very short introduction to the project Digit-Pre. Since you're here today, I'm sure you have heard a little bit about it at least, and we will not spend a lot of time on it now, but we just wanted to give you a little sense of the background. As you all know, I'm sure, we are facing major global health threats. We are looking at non-communicable diseases that are increasing. The same for mental health issues is also decreasing. We are facing an aging population, which is nice, of course, that people live longer. But as people live longer, they also are more prone to non-communicable diseases and other health-related issues, which puts a strain on the healthcare system. We're also looking at increased inequity in terms of social equity, etc. So bearing all this in mind, there is a real urgency that we need to address as soon as possible before it continues to grow too much. And we need new solutions on the market as soon as possible to react to these threats that we face today. And DigitPre is one of the responses to this urgency. So what is DigitPre? Well, it is a EU-funded I3 project that has a specific focus on consumer-facing solutions, where we are looking for examples within prevention, prediction, and remote care, to be more specific. The project will offer the accepted sub-projects customized support in order to get products to market faster as a response to the critical societal needs. And we will do this in the form of an innovation support program. This innovation support program is an up to 15-month-long journey where you will receive customized support and access to funding, both from the project, but also via investor networks. So the kind of core of this project is that we are both supporting SMEs to grow and get to market faster, and also innovation, but at the same time improving public health, which in our view is a win-win. I am also sure that you have seen this map before if you have been part of our other webinars, but these are the 10 European regions that are represented within the project. These are also the regions that you need to be present in to be able to be eligible for this project. And yes, you can also here see the 10 different partners ranging from clusters with specialized expertise to science parks, etc., and other innovative actors. So it's really a consortium with core competences to accelerate market uptake and also to help you scale up your innovation. Yes? Okay, so let's deep dive into the very first phase of this process that we are entering into now. I will give the word to you, Isabelle. Maybe you want to introduce yourself first.
Thank you. I'm Isabelle Lester from Toronto Pôle Nouvelle-Aquitaine, and we are a partner of DigitPre. We are in France for those who are not allowed about that, not aware, sorry. We will talk about the application and the partnership for the potential lead partners now. Next slide, please. So what is the open call we are talking about? It's an open call to select European consortia of small and medium-sized enterprises. I put here a link because it's about the definition of the European Commission. So you can have the possibility to self-assess your SME to know if you are entering in this definition. So this open call wants to select European consortia of SMEs developing digital health solutions, answering DigitPre challenges. You have also the link here, but I'm sure you are all aware of that because it's in the call text and call documents. For prevention, prediction, and remote care, as Malin said before, from technology readiness level 6, technology demonstrated in a relevant environment, to TRL 9, system proven in operational environment just before it goes to market. Next, Malin, please. Who can apply? So SME, status according to the definition, as I said before. Consumer-facing the product or service intended to meet the needs, preferences, and demands on end users to maintain or improve their state of health. The maturity level is important also. You have to be located in one of the DigiPro region. You can see on the right side of the slide. And the partnership is a team up with a SME that is located in another DigiPro region, constituted a team of a lead partner and a supporter partner. You can also have potential partner, potential silent partner, who are SMEs who are not in this region, or organization who are not SMEs. There is this possibility. And the consortium will submit a sub-project proposal. Next slide, please. Thank you. The eligibility criteria, there are 3 domains. First, the documents. There is the proposal, template to fill in, the declaration of owner signed by each sub-project partner, the GDPR form signed by each sub-project partner too, and the certificate of professional insurance or professional liability insurance according to the countries, provided by each sub-project partner. In the administrative part, the English language is mandatory, the SME status, the number and location of partners, and also the sub-project leader process to obtain the PIC number, the leader appointment, and the validation of European Commission. We put here the link for you, but we will talk about it just after in the next part. And concerning the sub-project, you have to prove that you are at a minimum of TRL 6. The sub-project addresses a challenge described by DigitPre or describes one aligned with the 5 broader areas that are also available in the documents of the call. The partners in the sub-project have cross-sectoral activities and considers the consumer-facing aspect, which means the beneficiary of the solution is also the user. Next slide. Thank you, Marie. Concerning this call, practical information, as a lead partner of the sub-project, you become a DigitPre partner. As you can see on the scheme on the left part, you are a sub-project partner, but also you become a DigitPre partner. And the application must be uploaded by the lead partner. All the documents have to be uploaded by the same partner, which is the lead partner. It's important to notice that for you. Next, please, Marlene. So the document to provide in your application, the individual documents, the SME financial status, the passport or ID for the lead partner, the SME registration certificate, a professional liability or not insurance certificate. There are also documents to be signed by all partners, the GDPR form and the declaration of owner. And you have, of course, the joint documents, which are the sub-project proposal, 10 pages maximum, as we said in the call documents, the guide for applicants, the PowerPoint pitch, 10 slides. You have also the template in the call documents and the proof of TRL 6 achievements. Next slide, I think we have, yeah. If you have some question about this part, we can discuss for a few minutes now, if you want. We can try to answer. I don't see any hands.
No, me neither. Maybe this part is very clear.
Okay. So
I mean, it's allowed to ask questions on the themes that we have already gone through. So don't worry if anything comes to mind later on in the presentation. But
yes.
Yeah, for the application, you have all the documents that needs to be provided, and also the templates can be found on our website, where you also will find the guide for applicants and other information.
Patty has a question.
Yeah, I see. Yeah.
Good. Go ahead.
Yes, good afternoon. Good afternoon.
Good afternoon.
There was a slide where there was a mention of cross-sectoral activities or something like that. Could you explain what that means?
It means that the idea is to have a sort of complementary between your activities, and as you are applying both or three companies, the idea is that when you will apply, you describe something with complementary activities that everyone could have something to bring to the sub-project or the solution you want to put on the market and you want to combine. I don't know. Is it answer to your question, Carrie?
Yes, thank you. Thank you.
Yeah, okay.
I think we believe that most of the sub-projects will be cross-sectoral by nature, since they are combining two different companies, which are probably not likely direct competitives or direct competition to each other. And by that, they should also be cross-sectoral.
We can I can share with you an example. We can say that one of the SME is working on an app for older adults, for example, and needs a partner with a more perhaps technical partner who is helping this company to achieve and to reach some goals they have. And in this sense, they are cross-sectoral.
But good question, really good question.
Yeah.
Yeah. So since we only have an hour, I think we will just jump into the next part, and then, I'm sure questions will arise as we go. But the selection process and the preparations.
So next slide. Thank you. So here, I won't go in detail of this timeline. It's just a remind for you, because this presentation will be sent to you after the webinar, and it's a sort of reference document. You have it in the guide for applicants, so you have all the process and the timeline. So I don't go in detail in it. The only thing we can say is that you will have the answer, the final answer of integration of your integration in DigitPrep project during February 2024. It's written 2023. I see. It's a mistake. Sorry. It's in the middle of February 2024. And I think that's it for now. We can go to the next slide. During the evaluation and selection process, which will be done between December and next January, all leaders or all lead partners are recommended to prepare for a potential approval. In order to be DigitPrep ready, you need to follow few steps to be validated by the European Commission. You have the validation of your SME, as we said previously, the PIC number, the LEAR appointment, and the validation of financial status of your SME. The last 3 points need the same link. You can click on it here, but you have it also in the guide for applicants. The idea is really to begin to enter in the process, because it's mandatory in the application. As a lead partner, you need to prove that you are engaged in the process, because we don't know how many time it takes to the European Commission to validate all the things. Not too much time, we hope, but really we need you to be to have done your possibility to give it possible at the end. So yes, the idea is really to enter in the process. Next slide, please, Marlene. Where do I start? The first step is to set up the participation identification code, as we said, the PIC, which enables you to receive EU funds as a direct beneficiary. Lead partners of selected sub-projects will become partners of DigitPre project, for whom the PIC number is required. And as I said before, in the proposal templates, lead partners have to justify that they have a PIC or are in the process to get one. Next slide. Yeah, we pick here the portal, a screenshot of the portal. So you have to register your company on the UC portal. On the page below, you have to click to all the tab and follow the instruction. It's really important. It's we can't detail all the process, because there are lots of little steps to do and to answer. But it's really important to go in all the tab and following the instruction. You have it below the tab. You have the instruction, so read it. We are here to answer to your question if you have during your process, and all the regional CAM responsible of region are here to help you. You will have the list for your country at the end of this presentation, and don't hesitate to ask us. But we couldn't go deeper in the process here. And next, yeah.
Yes.
Do you have already some question about this process or this application process?
So in order to be able to receive funds from the EU, you need to be registered in their portal. And this is what this process describes. You need to validate that you are an SME. You need to get your PIC number. And then in the same process as the PIC number, you will add a LEAR, which is a person that is in charge of your company, a representative for the legal entity. And also the financial capacity check. I think you are avoiding that one, actually, by receiving support less than 60,000 euros via this project. So I think the financial capacity check is something that you do not have to do. That is also why it's in brackets in slides before. Yeah, so that is good. You're skipping one step at least. But are there any other question on this kind of process? or, I mean, I'm sure there might be questions when you actually start doing it, when you're logging on to the portal and trying to add documents and information. If you get stuck, feel free to reach out to any of us, and we will really do our best to help you. We know from experience that this portal is not the most user-friendly, but we have all been through it and know a few tips and tricks here and where. So I'm sure we can help you through that process if needed. Okay,
Yes,
I see
Kari.
a hand. Kari?
Kari.
Yes, sorry for asking all the time, but
No.
if you have the PIC number, as we have, and we have done the process because
Yeah.
of other projects that we have participated in, is it then just enough to key in the application the PIC number, and we are good to go?
Yes.
Good.
It's the same PIC number for or one organization, one PIC number. So you don't have to do it again then. You can just add your PIC number to the proposal.
Yeah, thank you.
Okay, no other questions on this part? Like said, this is a step that we want you to, or we strongly recommend you to start with as soon as you have decided that you will apply for this project, because it takes a bit of time. And not that it takes a lot of time to add every info, but then the commission needs to process. And that kind of process might take a while. And we don't want to waste precious project time just waiting for the commission. So that is why we kind of push this step a bit. Okay, so once you have sent in your application and been through the EU screening process, we are now starting up and delivering the project. This is after you have been approved. So we will hear from the external evaluators who will screen all the project proposals. And after that, we will have our final set of sub-projects that will be a part of DigitPre. It will be 10 to 12 sub-projects that will be approved, and that depends on the budget. We have 900,000 euros to invest in companies, and we will share or we will split that investment to a large, or to the biggest possible extent, meaning it's dependent on the setup of each sub-project, if you're one or if you're two or three partners. So we can't say it's that we can grant 10 exactly, but between 10 and 12. Yes, so after you have received the approval, a set of regulating contracts need to be prepared and signed. Of course, templates will be provided for this. This is also described in more detail in the guide for applicants. You see the reference here, but there is a set of contracts between the project DigitPre and the lead partner specifically. There is also one contract between DigitPre and the entire sub-project. And then there is a contract between the lead partner and the supporting partner that is kept outside of the DigitPre consortium. And like I said, templates will be provided and also guidance if needed. So this should not be too complicated, we hope. So after the selection, we will be starting up. And before we can kick off the innovation support program, we need to proceed with the official process to include all the selected lead partners into the DigitPre consortium. This is an administrative process that we will do together with the European Commission. There are a few steps on this. You have to provide us with a budget file or fill in a budget template. We will also be preparing a final application where we combine all the sub-projects and add them into our DigitPre project activities. this is done by the coordinators, so it's not something that you need to worry about. I just want to describe the steps here. We will then receive the approval from the European Commission, sign the agreements I just mentioned, and then we can start the innovation support program. So it is a bit of an administrative process here. But like I said, we are preparing as much as we can. We're asking you to be as prepared as possible, and then we hope that this process will run smoothly and not take too much time. So the approximate dates for this process should be between mid-February and March of next year, meaning that the innovation support program will start March next year if everything goes as planned. Okay. During the innovation support program, you will, of course, receive a lot of support in terms of, it's customized for each sub-project, so it's hard to detail. But it's described very well in the guide for applicants, the types of services that you will receive or can choose from, and also the financial support that we will give you. So I will not go into that part here, but we all know that there is always a small catch to things. And of course, there is a reporting plan for each sub-project. We don't want to burden you too much with this, but it is important that we have continuous follow-up, of course. So there will be quarterly reports, progress reports, and also a small financial report. We will provide templates, of course, and it shouldn't be too much work as we want to keep your focus on developing your product or your solution. So hopefully this will not be too heavy of a burden on you. But as you can see here, they're due on month 3, 6, 9, 12, and 15. And the month 15 is the final report. Yes, I think that was it for kind of the delivery of the project. Are there any questions on this? No? You all are very well informed, I must say, which is happy. I'm happy about it. That you have taken the time to go through all the documents and that the information is clear. Okay, then we move on to the fourth and last part, and I will call on my colleague Aldo for this.
Hi everyone, I'm Aldo Vermiglio and I work with Malin at Innovation Skåne, and together with the rest of the DG Pre consortium. Quick wrap up, a couple of suggestions. If you already have decided to apply to the project and potentially have found a partner and are starting talks on how to apply, we suggest you start two pathways and potentially in parallel, starting to look at the logistical steps that Malin and Isabel have detailed, but at the same time start thinking about the approach that you're going to give to your application, assuring quality of innovation and concept within the content and the impact it would potentially have in the market. So it's two things to keep in mind. We're all here to support you on both areas, the more logistical step-by-step area, but also helping you out with soundboarding even on how you could, or what approach you could give to your conjoint application. And if you are still exploring and have not necessarily found a partner, or you have met with potential suitors among the other SMEs from other regions that are interested in DG Pre as well, Malin, the next slide. Just to remind you, all of you, next week we have a matchmaking week. I've recognized several of you that have already signed up to pitch your companies and talk a little bit more about yourselves. Our intention was to help everyone meet the person behind the proposal. Remember, this is not a moment in which you will generate a partnership even. It's just to get to know yourselves and potentially finding your next partner or exploring the solutions that are out there. It's going to happen from the 23rd to the 27th of October. Next, Malin, please. Next slide. Yeah. So already, so far, 25 DigiPreers will be pitching. I recognize several of you here, so that's great. You have received further instructions for the ones pitching, but also further instructions in an email that came out at 11:30, around 11:30, for the ones listening in. You'll be able to, following this schedule that you already have, and I'll provide a link to it, will have the opportunity to listen to pitches to all of the companies that are exposing their solutions, and an opportunity to also ask questions about them, about what their take is, what their approach is. So check the calendar, follow the instructions. It's going to be a single drop-in Zoom link that you can use for any of the pitches. And of course, if you wish to be present in all the pitches, you're more than welcome. I am going to attach in 1 second the link to the event where you'll be able to see that calendar.
I just did it.
You already did it.
You.
Thank you so much. Teamwork. Where you'll be able to see the calendar, and just if you're an observer or a listener, just click on the Zoom link provided in the website, and just participate and come listen. I think it's going to be a lot of fun, and you might end up meeting your potential next partner. So yeah, I incentivize you guys to do it. That's all for me.
Well, thank you so much.
Next slide.
Yes, next slide. There is one more, actually.
There is one more. And as told in past interactions, please don't doubt on contacting your regional representative. We're working very hard in not only trying to support you guys as SMEs, but also trying to find potential partners, look at others' business models, and think together a way forward. So please don't hesitate in contacting us. There's a question from Christina.
Yes, good afternoon. Thank you. I was just wondering, I didn't see our name on the list yet. We have also registered for a pitching session.
Okay.
And also received a confirmation email on that. And I'm from HealthFox.
HealthFox, yes, you are. You are on the list.
It's just too small for me to see.
No worries. I just wanted to show you the screenshot of it, but you are there.
Perfect. Thank you so much.
And looking forward.
Yeah, it might be easier to see if you click on the link. It's a bit bigger.
Yes.
Oh, these links are clickable. I didn't know that. Okay, thank you.
Yeah.
No worries.
Okay, I think I will just stop sharing. I don't have any more slides now, so I will stop sharing so that we can see each other a bit better. I think that's always a bit nicer. But feel free to just ask questions or share your concerns or thoughts. Let's see, who was first? HealthFox, Krishna, do you have another question, or is it the same one?
No, I think I didn't lower my hand yet.
Okay, yeah. You have to manually lower the hand as well. Maybe I should have said that. Okay, then Anna Katarina.
Hello. Sorry, I didn't catch the beginning of this webinar, so I don't know exactly what you talked in the beginning, but I have a question regarding the consortium establishment. So basically, we aim at leading a consortium. We have possibly identified a partner, but we would like to test the solution that we will develop together with a partner. And for that, we need real patients. And so we will need we will need support from a hospital to recruit the patients and test the innovation. Also because the innovation is supposed to be market ready by the end of the project, and without that step of validation with patients, we can do it. But according to the guidelines, there is only budget for a lead SME, the supporting partner, but for hospitals that are not SMEs, there is no budget. So how do you propose to solve this? Also because I saw that there are services provided within DigitPre, and those are living labs or test beds. Do those include patients?
I can answer your first part of the question with regards to including hospitals in your consortium. The hospitals cannot receive support because this program is targeting SMEs with their investments. So you have to be an SME to be able to receive financial and organizational support. However, you can include other types of partners as silent partners. Where they will join, but they will not receive any of the funding or the organizational support services that we provide. So, yeah, I don't know if that's an answer to the first part, at least.
Yes, I have understood that.
Yeah.
But still, how to solve the fact that we need validation with patients, and of course hospitals that are always busy will not want to join for free.
I don't know if Isabel looks like she wants to add something here. So
yeah, I can try. I don't know if it will fix, but I can try. As you said, we offer some services in the consortium, and we have networks, and in these networks, hospitals are a possibility. So we can help you in finding patients and hospitals who can be there for your tests. I think Margarida wants to add something, perhaps, about this topic.
I just want to add to what you said, Isabel, that we will try our best to find a good match with the test beds and the living labs that we have in our network, but it's not something we can guarantee, just to make that clear, that we find the right types of patients for your specific solution. Just before, we can't promise that before we have seen your full proposal, etc. Just to add that. Margarita, go ahead.
Hello, everyone. Good morning. So, Ana Catarina, hello. You are from Portugal. You are representing promptly. I have at this moment answered to your email. Thank you for being here. Okay. And just to add, like Isabel and Mali were saying, so the silent partnering figure will not have the ability to receive funding, but yes, we will have during all our innovation support program the opportunity to having a services catalog, an internal services catalog from all our regions. We will have the opportunity to select, as Melling was saying, the best fit for you to have access to living laboratory sites, to demonstration sites, to hospitals and collabs fortunately to you to be able to test your solution. Okay, so I think, please correct me, Malin, Isabel, if I'm wrong, and colleagues from DigitPre, our service catalog will answer to your specific question regarding the need for validation tests with patients. Okay, but that's another part of the project. To be awarded, you really need to have to establish the partnership with one of the companies that are here or in the matchmaking platform registered, and then apply for the call. And being awarded, you will have access to a lot of services, and that one in particular too. I don't think I don't know if I was completely correct or if I answer your question, Ana Catarina, but then we can talk a little bit more in Portuguese. And okay, I'm completely available.
Okay, I'm fully clarified. Thank you.
Thank you.
Thank you. Then I think it was Mikko and Maria, maybe. Who's next?
Yes, hey, hello from Finland. So our question is actually, who are our customers? Since we've been talking to a couple of companies, and we are a company who's actually training people who can walk or run still. So is it necessary that we are working with hospitals or people who are already hospitalized? Because I thought this project is about people not getting to any hospitals. And with one company we were talking about the cooperation, said, hey, we have a different group. We want people who are already patients somewhere. So I don't know. I would like to work with such companies who are also helping people not to get to the hospitals. Maybe something to go do with nutrition or any type of exercise or mental health and things like that. So how should we proceed? And also the one problem is that one company from Portugal is not answering to us. We've been calling them, we've been emailing them, we've been putting messages through LinkedIn, but no, they just don't answer to me. So please help us.
Okay. Yes. That one, the last part goes to Margarita, and maybe she can help you get hold of them. So reach out to her, and she can see if she can get hold of them, or in some way connect you again. But if we look at the first part of your question, I see all of my colleagues nodding here, smiling excitedly, because we are very much into working with prevention. So you're right on target. We do not have to target patients at all. We can very easily also work with consumers. The idea is that the solution is consumer facing. That could be patients, but it can also be just individuals that buy or find your solutions on the private market. So yes, the answer is prevention, preventative work, predictive work is also very much in line with this project. I hope that was answer to your question. Yeah. Okay.
So
perfect.
Thank you very much.
Thank you. I think next up is Krishna again.
Yes. Hi, thank you. I've got many questions today.
Yeah, go ahead. We're here for that.
I'm just trying to understand a little bit to make sure we have got various solutions in place. So some of them have already been, in use in hospitals, and it is been verified, and of course, we've got the support and the backing of the hospital because we've been working with the hospital partners. And then we have other solutions that has been created and developed together with healthcare professionals, of course, but it's not per se as well already in the market. So what would be kind of the best approach for this project? Products that's already proven and tested and we have the papers, or these products that kind of we know it's scientifically sound because of literature, but it's not been tested in a clinical environment, for instance. And then how does that go together when it comes to seeking a partner? Do we, when it comes to co-development? So do we then, I'm trying to just make
Yes,
sure
of course.
that, I don't know if that makes sense.
It does make sense. And I would say just initially, I'm sure a few of my colleagues can add to this, but initially I would say that you should go with the solution that you feel is, there is a two-way road, okay? Either you go with the one that is well established already and can continue to work on that, maybe move that into a new market or go international, use the project for that. Or you take the solution that is not as developed and use the project to speed up the development process with the help of a partner. So it's really up to you. We can't say that this will be more beneficial than the other. I mean, it's up to you as a company in which way you want to kind of use this project. Yeah, both Isabel and I think also Aldo might want to comment here. I don't know which one of you who are.
I'm just putting a thumbs up because it's really up to you and the impact that you think it'll have in the shorter or midterm, or even thinking practically the feasibility of that happening, or the partner that you actually feel a connection with, who could help you, what and where. So it's, as Malin said, from a potential springboard to a solution that is already tested but in need in another market, and maybe that other partner could potentially help you have a doorstep into a customer that you feel you can go into, and of course a benefit for them too, or streamlining a solution that's being developed and accelerating the time to market to a specific market, or adding an additional feature. So it can come in many ways, and the project is quite flexible on addressing that, to give you the liberty and the options. Sometimes many options overwhelm us, but we've wanted to be very open, as long as the value that you're trying to bring on is solving the objectives and the value that the project itself wants to put into the market.
Okay, thank you.
Isabel, do you want to add something to that?
Just wanted to add to keep aware on the fact that you will have to give proof in your application that the solution you are presenting with your future partner has to be at TRL 6. So if you, from my point of view, and it's an advice, if you are too low, and perhaps you will be under TRL 6, and it will be difficult to prove your TRL 6 for applying. I don't know if I'm clear, but perhaps it could help to think about after that.
Yeah, thank you. Now, our TRL is, it's 9 and above, so that's not the problem. That it's more the clinical parts, because when you work with digital health, it's not just the technology, it's the clinical things as well.
Exactly.
That merry happy medium. But thank you. That's helpful.
Yeah, give it some thought, and I don't know which region you're in, but reach out to your representative and use them as a sounding board in order to kind of process this a bit and see which way is better to go. Finland, cool.
That's right, yes. We've spoken to Lauri.
Lauri waves a bit. Perfect.
Yeah. Okay.
Margarita, you have your hand up, but is it new?
Yes, just to add to the previous comment, I think it was Vautisamako. I'm so sorry for not pronouncing correctly, but I have added in the chat my email. I'm so sorry for not being able to contact the Portuguese company and not having answer from them. Please contact me or leave me in the chat your email, and I will gladly help you, okay, to contact the Portuguese company.
I just connected you via email, so you both should have received an email from me.
Thank you, Laurie. Yeah. Thank you.
Perfect.
Obrigado.
Do we have any more questions? Is there something you're concerned about? Is there something that is hard to understand? Is there something, is it, yeah. Are you already talking to partners, or can we help you somehow there? Okay. I take the silence as everything is clear. Perfect. Like said, we will send you this presentation just within a few days so that you can go back and have a look. And yes, feel free to reach out to us. We know it's a lot of information to digest. And like Aldo said, there is a lot of options connected to this project and a lot of opportunities. So it might be hard to choose with which path you want to follow, but we are here. We are more than happy to be a sounding board for you and a support in this process. So feel free to reach out to us at any time. You will have all the contacts in the presentation that you will receive. So if there are no other questions, I would like, on behalf of the entire DigiPre team, say thank you so much for joining this session, and the best of luck to all of you in this process in applying. Have a lovely Thursday afternoon and take care.
Yeah.
Thank you.
Thank you all. Bye-bye.
Thank
you all.
Thank you.
Bye-bye.
Bye-bye.
Bye.
Bye. Thank you.
Thank you. Bye.
Thank you, Zed.